All right, everyone. This is Dr. Shahriar, your mentor for AMC, and like to congratulate those doctors passed. I think still some doctors yet to come to the seminar. Please tag them in the comment section, or you can share the link with your friends to invite them to come to this session. It'd be more than welcome, everyone. All right. So yeah, because people like asking a lot of things in personal inboxes. We do answer, so that's why sometimes people don't feel like coming to seminars. But it's more easy when you have presentation to give some personal inquiries actually. Right. So please guys, if you have a study partner, give them a buzz to come to this live event. I mean, those of the doctor passed or those of the doctor just finished the August. Yeah, so that'll be good actually, answering these particular things and get clarified. And we'll be answering some personal questions as well at the same time. All right. That's wonderful. Yes. This is the thing happens, see, this is the one problem I was talking about. Like whenever MC1 finish, people get so busy in celebration and a lot of things like that, that uh, this is one of the reason, people um, not remain that serious in MC Part 2 exam actually, and this is sometimes reality. All right. So how intense was the MC1? If you all remember, uh, coming regular classes and this that, and you can see like when pass, like very less people are coming actually. So it's okay. I mean, those came, they will be clarifying the answers, and those of you are in the July group, please make sure you send the Zoom link to any of the friends who passed in the July. Feel free. I mean, if any class monitors out here, they can also reach out some of the July past candidates actually to send the link and join today actually, because by the end, I mean, I will be answering some personal things actually, because normally it's difficult like for me to answer things, and now we have the presentation, so that's great. All right, so guys, so first of all, let's start with that one. Congratulations on passing the exam. I think we do have some doctors, like we can see I can see uh, Dr. Nusrat, I can see. Very nice, I think. How are you, doctor? Guys, let's it's like small people here, so you can unmute your mics as well, not a problem today. Yeah, so how you guys are doing, please let me know how you all are doing. Dr. Nusrat, I can see, I mean, how are you doing? You can unmute your microphone, it's also good. uh, Dr. Sana, I can see, and Dr. Rupinder, I can also see that. All right. Yeah, yeah, you can just inviting you to come to like open mic actually. How you're doing. Part two is all about talking, so yeah, can you unmute your microphone? Okay, it's allowed actually. Okay, let me see.
Hello, doctor. Thank you so much. I was actually doing something, that's why it was mute. Sorry,
Oh, okay.
doctor.
Oh, no, no, no problem. You came actually. Many didn't came into the seminar. That's okay. After passing, I can
Yeah, no,
understand. So
everyone
big
is just, yeah,
celebration.
everyone is still enjoying partying.
No, but thing is, this continues too much sometime. What I have tried and what I see in
Yeah,
many,
doctor.
that see, both exams are tough, to be honest. MC1 is tough, MC2 is also tough. But
Yeah,
it happens that people are taking too much time sometimes for MC part 2, so this is one of the thing, so give the same respect for the both exams actually, and also do not think that MC exam is impossible to pass. Those are good candidates, good vocal, bit confident, they get through it actually. That is the thing. Even
yes.
think in that way, if one time, if even accident happens with anyone, even in part 2, you can just appear in again in 2 months and then finish it. So my thing is like, you should be finishing it in next 1 year actually, in any way actually. I mean, you should take a 6-7 months maximum, and then you appear. It's ideally, I was talking to one of our another tutor, Dr. Qureshi. So she's been very expert on this teaching things, and also teaching most of the Australian centers as well. So she was telling one thing: it was the right time for MC Part 2 exam, and that one is actually when you study and when you start doing role play, when you are a bit confident, then you should take the exam date actually. Okay, so it's not the same um, plan as like in MC. In MC1, what we do, we keep pushing you that take an exam date, take an exam date, because there
Yeah.
is a free change, right? Like MC exam date, you can change it for free, right? Like you can change it for whole 1 year for free, but MC2 you can't do it. When it's done, it's locked. You can't change it.
Okay.
All
Okay.
right.
Okay.
So that is the
Oh,
thing. So you need to be sure that before going for the exam. So you start
okay.
something, you prepare well, and when you see that you are confidently doing the role play and finishing things, so
Mm,
roughly, I mean, we would say it's like 8 months. It should be taken 8 months, 9 months, because 4 5 months goes like example courses, become a mastering of those cases. You start doing role play. Another thing, no matter wherever any one of you join that with me or without me, but anything, you should do the role play more early. Some cases, a lot of doctor, they focus only on the theory. So MC2 is not about theory. MC2 is more about you need to talk. That's
mhm.
most important actually. Yeah.
Yes,
So
doctor.
that's more about the talking thing. So that's why it is very, very important. Now, I think before I proceed, I know I just like to invite Khaled actually. So he's here. He will just congratulate you guys, and so he will leave. He was busy in working.
Yeah.
So
Hi
hey Khaled.
everyone.
Yes,
Hi
Khaled.
everyone. Firstly, congratulations to all of you on passing the MCMCQ exams, and hope you guys are doing well right now.
I hope, yeah. So that's good to have Khaled on deck. Yeah. So that's
Yeah.
great, guys. Like please respond. It's open mic, so you can also unmute and reply. That's fine actually. That's the motive for open mic seminars. You can unmute until, yeah. So it's a great thing. So he's the man behind the scene of interacting with many of you, helping. So also thank you to Khaled as well, actually, even from my side, for taking care of all
Yeah.
the candidates. Actually,
Dr.
it's
Shah.
a difficult job. Yeah, yeah, it's a difficult job, man. Difficult job. Always, actually, we know how, you know, we manage. We know, how it goes. Actually, so many inquiries, people get so much scared if they don't get, answer back in 24 hours. Actually, so it's a tough job, actually, to be honest. I mean, from our side. So I'd like to especially thank to Khalid that taking care so of all the candidates really well, because yeah, so that's the great actually. So I won't take much time from Khalid actually. So how do you feel, Khalid, sometime being seeing the candidates and their progress overall actually, and someday many of them I think start doing job. So how do you also see these things actually?
Yeah. Like from the beginning, I start from the beginning, from the
Yeah,
admission process,
exactly.
not just from the admission process, from the inquiry process. Then I do come to the admission process, and then they get enrolled to the program. And different doctors, different cultures, different countries. It's a very different
Mm.
feeling as well. Getting connected with a
Yeah, it
lot of
feels
people
good.
around the world. It
Yeah,
feels
yeah.
good
You're
as well.
also connected. Yeah, so many people.
Yeah. So
So
it's
that's
it's
and
fun. It's
like
fun.
if we yeah, yeah, like love some adrenaline rush too at the same time, I would
Yeah.
say.
Yeah. Yeah.
Sometimes. And
Yeah. Sometimes
like
very
interesting
nice.
thing, like I want to like refresh the memory that I started the teaching journey in 2016. There was a small place I used to teach like face to face in the beginning. It's very early days, like few doctors approached after I passed my exam. Then I started in 2016. So it was not a internationally we opened. We opened internationally in 2017. So 2017 I started this thing online, and it was pretty okay. Then I realized that things are getting bigger. So Khalid has been my friend, I think, always. Yeah. So he always has to have fun and things. And then I approached him that, okay, let's, why don't you give me hands and the things actually. So he got agreed, and the interesting thing I remember, I mean, you remember too, I think, Khaled, that, let's find a office actually. My father was telling about, okay, legalization of the
Right.
procedure that, okay, if you are doing a company and things like that, and if you want to make it good, like getting license and all this thing, you go for license, but in order to go for a license, you need an office place, genuine, so that, you have paper and you submit it. Yeah, so we went there that, I remember, and I think it didn't take much time actually, to get that office place. So I think I was in your bike, I think. So we went for
Right.
to, see like a rent and the thing, and that, okay, let's go on this one. It was interesting, turn out to be that place we have the office, in 369 by B, Khilka Taltola in Dhaka. So in that particular place, I think it's also related to one of my uncle's friends actually. So we went there, and then turned out to be, he's also familiar, but I didn't know that. So then we, rent that office, and then, after that, it's been, I think, how many years, Khalid? I think it's been 5, 6 years now.
6 years
Yeah.
going.
Yeah, so
Like
it's kept going actually
right.
now, so from 2000.
Never been
Yeah.
bored for the last
Yeah,
6 years. Never bored for a minute. It's going on.
going on actually. Yeah,
Thanks to
so that's
everyone.
the thing.
Thanks
Yeah,
to
thanks
everyone.
to
For
yeah.
being on.
So I wish all the best, Khaled. He had a long day, I think. So he's from the
Yes.
morning he's working. So I just thought of inviting him as well, actually. Yeah. So thank you, Khaled.
Yes.
So we'll just get into the seminar,
Okay.
and you take rest and proper fluid. I know how it feels after a whole
Yeah.
office day. Yeah, especially. All right. Thank you so much
Okay.
again. Actually, let's come
Okay.
back
Take care.
to like yeah. Thanks. Thank you so much. So let's be back to this one, and we'll get with this seminar. Yes. Yeah, buzz him. And, many time even in my messenger, also he has like, access. So he also helps. So many time, many things. So here is the thing, like this topic is about, today is two portion. I'll take initially 15 minutes to just tell you a few things like regarding MC Part 1. Again, if anyone joined later, congratulations on passing the Part 1 exam. Just let me take out the screen for a second. And yeah, just need to update something. I think, the good news is actually we have, yeah, reached 1,000 doctors in terms of the passing. So I think we can say this is a milestone seminar, I guess. So I think, yeah. So I think, just correct that one. I think previously it was 900 and I think 73. I think in July, I think it's over, I think 35 passed already. All right. Over 35 passed already. I haven't count the exact number, but I think it's 37 or something passed, I think in the month of July. We are recording this video on 2000, um, August 2023. So I think it's a proud moment, like, the like 1,000, people, I think it's recommendable, not easy job, and many in the pipeline, I'm sure many in coming days. It will be good actually. Yeah. So like I had this thing in mind that, okay, like if I open something, there should be like 1,000 people pass actually, so now it reached almost over 70 countries. That's recommendable as well. I mean, uh, thought of doing internationally teaching, but never thought of going this big actually, so thank you for your responses and all these things actually, and keep supporting us. We'll try to keep supporting our students too actually. Yeah. Now coming to this, like, what you should do next, a lot of confusion that comes out. I know, like, it's sometimes confusing for a lot of doctors. Sorry about this one. Yeah, I was taking class, so you can understand earlier, and yeah, so just finish it actually. So thing is, when you passed MC1, now I would like to ask you guys, like, everyone can unmute and tell what's going on in your mind. Dr. Sana, Dr. Neha, Dr. Manpreet, Dr. Rupinder, what's going on in your mind actually? Like, Tell me, like, what's going on. Like, let me answer question according to that, actually. Dr. Manpreet, everyone please unmute your mics, guys, please. Yeah. All right. Dr. John is here, actually. John. Yeah. So, Dr. John, what's going on in your mind? Like, what is the first question come in your mind when you pass MC1? What you want to do? Of course, you feel very happy and we are proud of that. So, what question comes in your mind?
Well, what to do to get a job as quickly as possible. And
Okay. Job.
yes.
Okay.
And
As soon as possible.
yes. And then yeah, basically. And my next step is the English test, and then on to the AMC too.
Okay. English
Yes.
test. Great. And how many years of experience do you have?
I have 5 years of experience post
Okay.
internship.
Okay.
Yeah.
Post internship. That's is excellent. So we'll talk about this thing, so we got from like Dr. John. We'll come back to Dr. John again. So the thing coming in mind is getting a job as soon as possible, and then English test. What about Dr. Sana and what about Dr. Hazel and anyone wants to add anything? Dr. Manpreet, if you want to add anything, guys. In case if you can't reply in the mic, you can also write it here. Actually, maybe some of you can be in the duty. Okay, so another Dr. Kunusa also mentioned to pass the English test as soon as possible. We'll talk about the English test as well. Anything else, guys, that goes on in your mind? Nothing about MC2, okay? Like you also need to pass that one, right, at certain point. Okay, let me put it there in that way that okay, MC two. Okay, someone said okay, observership. Okay, that's a good point. Observership. Anything else, guys? Yeah, so these are like, certainly some points in your mind. Observership, we'll talk about that one. Not a problem. I can tell you one thing, Dr. Dr. Neha, can you be online if it's okay? I mean, if you're not in duty. Sorry, guys, I'm taking water because I finished a class. Yes. Hmm. Okay, so Dr. Neha is here. Dr. Neha, can you hear me?
Yes, yes, I can hear you. Am I
Uh,
audible?
con- you're audible, and let's start with a big congratulations to you for
Thank you.
finishing the exam successfully. All right.
Thank
Okay. So how do you feel now? I mean, relieved, right? I mean, the first word, I guess.
Yes, I feel relieved. For the first day, I was very happy, but from the second day onwards, I was confused what to do now.
Okay, okay. So is your confusion is in this fourth topic, or is there any other thing we should add that's also in your mind?
No, I'm confused between these things only.
Okay, these things only. All right, doctor. No worries. We'll be answering this some of the points, and you did very good job. I'm really proud of you. Actually, congratulations once again. Actually,
Thank
you can also unmute and ask me anything during the session. Actually, and
Sure, sir.
Doctor. Okay, sure. And anything with Doctor Dhananjali? Anything you want? Miss, can you be unmute?
Yes, sir. My concern, thank you, sir, for
Yes.
helping me with the
Yeah.
MC Part 1. I passed in July. My concern is whether,
Congratulations.
thank you. My concern is whether I should go for MC2 or go to do English tests and apply for jobs.
Okay. Let me add in another way. MC2, um, MC2, or have you anyone thought about PESCI, or has anyone thought about WBA? I like to extend your confusion a little bit more, right? And there's like MC2, PESCI, and WBA as well, right? So this is another thing, like which way to go actually. And another thing, English test or MC2. Of course, like you need English test, like the basic. If I talk, you need definitely English test first actually to apply for any job. Actually, without any English test you can't apply for job. This is the basic. So if you have any plan, first of all, let's clarify one thing. If you have any plan to apply for a job, in that case, this is the first thing first. And I would be recommending more like a PTE exam, because OET has been a more difficult in recent time actually. But if your background is in English, you're very confident, you can also go for OET. But OET has been expensive as well, certainly. Okay, yes, we'll come back to that part, Dr. Nusrat, that AMC clinical first or PESCI after English test. We'll come to that part. This is a topic of discussion with our session. If anything come in your mind, let me know actually. So these are certainly some topic like English test, job, MC2, PESCI, WBA, CV tips, and CV related more things. We do seminars like when in the beginning of the MC2, when we take classes, some format and things. I took a session, Dr. Qureshi took a session this time. I think another expert, like one of my friend, Dr. Limon, will also give a hand to give you guys some tips actually on that one. Okay, so again, congratulations to all of you, and moving forward. Yes, dance party is going on, and as I said, someone yesterday was doing party, and now is this party is about to begin actually. So English test, job, MC2, PESCI, CV, question answer. Now let's first just do the English test. What I mentioned already about English test is, you know, is English test required for AMC um, exam? Like, for part one exam, no. For part two exam, no. It is only required for applying the jobs, only required for applying the job actually. So this is the reality. Now, if you are a fresh intern, you have an experience less than 1 year, you should focus fully on MC2. Okay, is there anyone here who has less than 1 year of experience, guys? Anyone here can unmute and tell me here. Anyone here, other than internship, has less than 1 year of experience? No one? Okay. Looks like everyone has here like more than probably 1 year of experience actually. If you want to comment in the comment section, that's also fine. All right. So if you have like 1 year plus, and usually we recommend if it is possible 2 year, then you can always apply for the job actually. That's one of the things. Okay, coming back to more things like among the tests, what are the tests are available actually? Like talking about the English test, tests are available actually, like these three are the tests, but among them, what I more recommend for AMC doctors is a PT exam. So I would say PT would be perhaps a more easy, cheaper, and the results are more faster. If you want to start applying jobs so quickly, if you apply PT, the result will given immediately, and you can start applying. And preparation is also easy. This is one of the things actually great. Next thing is actually coming up is job apply in Australia. Now that's a big thing. For this one, we take also separate seminar, because whenever we talk about job, your CV, cover letter, your experience, your selection criteria is another thing. That is a very big thing to discuss. Selection criteria usually we discuss in our MC2 courses, like especially job hunt sessions we take. So there's another thing will come of selection criteria. And based on every hospital, you adjust your writing, you adjust your CV. That is called the selection criteria. All right. So this is important. Even if you've seen any movie, like there's a very famous movie. Let me know, like if you guys also watch movies. Like example, the famous actor Leonardo, he has a very famous dialogue. I know he give you a pen like that actually, and he will just ask you, please sell this pen, to one of the person. Which movie dialogue is that one actually? Does anyone know this one? You can unmute, guys, participate. A very famous one actually.
Catch me if you can. Is it the movie, sir?
No, not that one actually. There's another one actually.
The Wolf of Wall Street.
Wolf of Wall Street. Yeah, I mean, if you never have seen that one, you should see it actually. The Wolf of Wall Street actually. It's about the marketing. So it's talking about that one. Your interview is more about selling yourself actually. Okay. So it's like you make some changes in your CV according to needed. Everything may not has to be 100% right, but you make some changes. So different hospital, they have different questions, different hospital, they look for different criteria. These are called selection criteria. Okay, so you go interview, you tell that you are very dedicated, you are right person for this job. So make them believe that one actually. Then they might ask you if you want to Q questions like, why you need this job, why you came to Australia. Looks very simple, but some cases the answers you need to be very much tricky while answering that one. All right, it's very, very important. So, I mean, attend interviews. Initially, you might not get interviews because you are not applying properly. Understand one thing, this is another dilemma, like why choosing job or starting MC2? Because if you apply for the job, I would say for next 3-4 months, just dedicatedly apply for the job. You don't need to go for that MC2, I would say, because individual application takes like almost 1 hour and you have to apply different hospitals, so many hospitals. Maybe you have realized sometimes I post um, job related websites in our group, right? So probably you can see that one, that just some of the job related, that particular website. I will try to post that link again in after the session actually, the like what hospitals and the relevant websites, and I'll post a link actually. But this is a very big field, like you need to be smart and just be ready for the interview, have a good CV so that you got picked up, and then you can go to the interview. It is said that often main doctor said when you apply 40 hospital you might get your first interview. Okay, it is not necessary you get interview means you get a job actually, but there will be a probability that you get a job always actually. So be smart, be well spoken, well dressed. That's the thing. Interviews are mostly online actually. Some cases walk-in interviews are also available actually. Okay, check in, like if they have an option. For example, if you live in Sydney and there is a interview in the Sydney or interview in the Newcastle nearby, you can just drive and go for the interview. That's up to you. So they give options like that actually. So that is one of the things. Great. So job related applications and the things out here. And guys, I want to check, like, have you guys seen these two videos actually, like tips and tricks about the job? So where it's a short video in my YouTube. If you haven't, like, please take note that you go to my YouTube channel and just how to secure a job in Australia as a doctor, then type my name Shahriar, or you just directly go to my YouTube channel and search the videos, you'll find this one. Okay, mainly I was talking about in this video about indeed.com, and there's 2-3 other websites as the main website for the job. Now guys, I mean, if you want to take something from this seminar today, have you guys opened any account in indeed.com? Please comment in the comment section. Have you guys opened anything in the indeed.com? Please comment in the comment section. Not yet. I can see some says yes. Okay. So will you do that today or tomorrow? Within next 24 hour, I mean to say. So can you do that in next 24 hour? All right. Yeah, so start with that one. If you want to take something from today, the first thing first is open website, open a account in indeed.com and in the job websites actually. The first thing first. I will try to share a AFRA relevant resume today. Yeah. Websites, yeah, website I'll share. Yeah, no worries, dear. I mean, websites I'll share actually. Website is indeed.com. If you just simple type indeed.com, that's fine. There is more hospital relevant websites too actually. But if you in generally search indeed.com, you will find it actually. The only main website is that one. All right. That's the thing. Now coming to more things. Yeah, here is that thing, indeed.com. This is how it will look like. Okay. So please take note. The first thing first, like, you just need to go and open and sign up first. Okay, sign up first. That's the thing. Those of you who haven't passed the MC1, 2-3 of my class monitors are, I think, also attending from they will appear in soon. You can also open account in indeed.com. There's no harm actually. You can keep checking what positions are available, this, that. This is another website, guys. So previous one was the Indeed.com, and these two are the main websites. These are the websites to apply for the job actually. So different website where different hospital they advertise or different positions are open. So these are some of the websites, guys. I'm holding here for a few seconds, yeah. Or maybe you can open up a tab in your laptop, or open up something in your mobile, or just write it down. Just you will open another sign up in Merge Job WA. Yeah, you can do that, guys. I'm telling you, if you are looking for to apply for job, and if you think, like example, in the beginning, Dr. John mentioned that he has 5 years, I would recommend him like next 3 months. He should not think anything about the job, like I mean anything about the MC2, how to prepare this, that. He should dedicatedly apply for the job and see if his lucks are working or not. Please keep it in mind, MC2, if you have highest chance of securing a job. Okay, so your competitors should be those are in same boat, like example Dr. John, like same 5 years is a very good handy amount, and on the top they have MC2 on their back. So of course their CV is much better. Second thing is coming the status in Australia. Like status in Australia means if you're staying in Australia, maybe you have slight chances more securing a job. It doesn't mean that you have to a citizen actually. It like means if your status you are already inside Australia, there is a slight more chances that the similar kind of like another candidate and another candidate in Australia, that because they don't have to give like invite like separately too much like from another country, because the person is already inside Australia. Sometimes that's when you can join. So give them a probable answer, give them a like good answer, like when you can join. When they ask, if you said, oh, if you yeah, I can join from the like in next 15, like you are already outside the Australia now, how come you join in 15 days? So give your answers appropriately. Like see, yeah, so I live in, for example, I live in currently, say if you say you live in India, but I'll try to make it as soon as possible. Depends on I get the sponsors and the things. I'm really interested for this job. I'll try to make it in a month and a half actually. If you like, they want on and stop union, but if you just figure, oh no, I can join in 15 days, how can you join actually? So they like you, then they can even wait for you. This is reality. I found another student, not one, many actually I've seen, like they joined like after 3, 4 months. Yeah, because the HR, they have job options in a lot of hospitals. So once they like someone, and if you maintain the good connection with them, definitely they will consider you actually. So it's like, yeah, I'm doing a job now, and I think I have to cancel the contract with them. I have like 1 month of contract left or 2 months of contract left. Will that be okay if I join in 2 months? But I'm really look forward and interested in your hospital. Say this thing with enthusiasm. They will understand. Okay, the doctor is doing a job in hospitals, and they understand these things. In our country, we know you can leave the job anytime, but in those countries, it's all contract basis. So they believe this thing. Oh, you're in a contract, like, okay, you need 2 months. Okay. So, your words should be like that, like tricky. Now you should know about the laws and lot of things actually. Like, don't just tell anything what comes in your mind, because they're professional. They will find it. Okay, oh, I'm doing an hospital, I have commitments. So I just at least need a 1.5 month to finish it. So finishing it, then I can join definitely. But my choice is your hospital actually. Like end up telling this thing that you're really, really interested actually. But one more thing, um, in our culture is sometimes if we really look forward to someone, we really start doing too much interest actually. That thing, don't do it, when you are interacting with an HR actually. If you just like keep showing that without this job, like you're dying and this that, don't do that actually. Just be professional with them, answer nicely, answer right, um words, choose the right words actually, appropriate words actually for them, professional words actually. So you can use some softwares also so to make your words more nice. Like Quillbot is a very nice, like software to organize your words actually. Like there is option, like you want to put it as a professional, like you write something and then put it, click the professional, it turned out to be very professional. So they also check this thing, which doctor is interacting very casual, which doctor looks more professional and things. They understand it. Yeah. So whenever you are joining as HMO level 2, level 3, and your positions are JMO, SMO, or SHO, whatever, like register, consultant. These are your positions there actually. Consultant has also a lot of. Can you take a job to AMC part 1? If you have experience of like approximately 2 years, definitely you can always actually. It depends on maximum hospital application. One of very early days in 2017, one of my student got job in 2017, and she mentioned one thing that uh, sir, please tell all the candidates to do, if possible, do an observership, because she did observership and finished the AMC2 actually, because she has less experience. So she finished the AMC2, she got an observership, and in the same hospital, even till that she's doing the job actually. She says its name is a Northern Hospital, somewhere in Australia. Okay, her name was Dr. Preet actually. So very good, and good student, very good mark holder, I remember. So finish two, did observership, then joined the job actually. Okay, so one more thing, please remember, like even if you get a job, they will push you for doing the MC2. Now that becomes sometimes difficult, balancing the things actually, like whether to do the job or whether to do the AMC2, because we are more familiar with taking preparation, like wholeheartedly. But in those countries, when you enter, they will think that okay, you are doing job and you can also prepare for the exam, because they are built in that way actually, right? So that is the thing. Okay, about the clinical gap, guys, have you seen this video before? Please comment in the comment section. Have you seen this video before? Now, I would like to see if anyone has any question here about the clinical gap. 1 year equals to 1 month of clinical practice. It has to be 1 year equals to 1 year of 1 month of clinical practice, at least it would be. Now, if you are living in Australia for 3 years and you haven't been to your country, so you need at least 3 months of uh, home practice actually. Maybe you are in Australia, you go back to India, go back to Bangladesh, go back to Pakistan, and do 3 months of training. In that case, actually 1 year equals to 1 year of 1 month of clinical. Yeah, so that is the thing. More information's out there, please go and check that one, how to cover it. I also talked about few things about the CPD. This brings us to one of the thing. Is CPD going to cover your longer gap? Answer: most cases it is not actually. If it's a too long gap, more than 2 years, probably CPD may not cover everything, or things getting just keep expensive actually, because CPD, some free available, but um, the many others are expensive actually. So you just keep spending, rather than you can buy a ticket, go to your country, even stay there for a while. Yeah, so minimum you can do even 1 month, that's not a problem. But ideally, if you can do 3 months, 3 months are more nice. Remember one thing: 3 months, 4 months, these are more nice actually if you can do it. All right, so 5 important things for the job: work on your resume, apply all RMO or JMO campaigning. Actually, it's called JMO campaigning. Have you ever heard about this term, guys? JMO campaigning. There's a nice thing. It is called JMO campaigning. So you can type about that one, like JMO campaigning 2023, JMO campaigning 2024. So you'll find the link. So again, a lot of hospital will be directed, so you can start applying your CV actually. Email maximum hospitals. I'll post some hospital links today, and consider some of the recruiting agencies actually. Okay, consider some of the recruiting agencies. That's controversial. I don't give any comment on that one. There are some recruiting agencies also available. Yeah, so some people say, doctor, is it reliable or not? I don't know actually, reliable or not actually, because there are agencies too actually. They took a lot of money and they try to organize interviews more, so things can be faster, Right. So that's the thing. A very important thing is networking. Rather, networking works more well actually. Like you keep good in touch with the HR, like good touch in the friends who are already securing job, and keep improvising on this your CV. You will get a job in any way. So this is the main way, like networking and getting a job. Actually, job will not come to you. You have to go to the job. Actually, it's kind of like that. Yeah. So, I mean, is there any question regarding the job? I'll take one or two questions now, personal questions from the doctors. Feel free to ask me some questions now, guys. Okay, guys, so any questions, feel free. If it's your personal, no problem. Anyone can ask me. Even class monitors can also ask me, no problem. Any question from you, Dr. Dipanjar? Or Dr.
Hello,
Vijay?
good evening, sir.
Good evening. How are you doing?
I'm doing, sir. I'm doing fine, all right.
All right, so you'll get through, no worries. Yeah.
I would like to know more about regarding the clinical gap, and is it okay if the clinical gap is covered through a job, and what post should someone have,
Right. Good
and
question, actually.
whether it should be a training post or whether it should be a job?
Okay.
This is what I want to know. Thank you, sir.
Good question. Yeah. So, like, see, any jobs are fine as long as it has paper. Any job is fine. Clinic, training job, non-training job, anything is fine. Actually, they just want to make sure that you are doing a job. Actually, now, next thing is coming. Is it a paid job is better or just observership job is better? Both are fine. Actually, I would say. Actually, like example, like I know one of my friend, like, she was actually in Sydney and she was not getting the job. Now, what she did, she came to my hospital was Holy Family Red Crescent. So she came back for like a three, I mean, she has like almost 5 years of gap. So she did like 3 months. She went back after that one. It was observed, not a paid job. Okay, she did that and went there and applied again. She got a job. Same thing I've seen with many other actually. So uh, paid would have been more better. You have pay slips and all this thing, but otherwise, if you do the observership or any sort of training or something, observership or training job or whatever it is, like any reputed hospital would be more better actually. All right, so that's the thing. Someone asked a question, Dr. Hazel, like in a clinical gap 1 year. So is 1 month of training need between MC? It is any time, my dear, actually, it's better. But, I would recommend try not to keep your gap too much, actually. Like example, if you already have some gap, so it's okay. You can go back for 1 month and still can um, in 1 month you can also stay in the country and if you can do a little job by someone who is close and go sometimes and give rounds in the hospital and get a 1 month of paper, that's also applicable actually sometimes, rather than if you know that you're not really sure when MC2 will be finished and then you will go and yeah, so increasing the gap is not that good actually, but if you don't have choice, you can do it after the MC2. I hope so that helps with your question, I think. Yeah, so it's not necessary it has to be always before MC2. You can do it also after MC2. You can also do it actually, that's also fine. All right, so that's the thing, but make sure you go to your country, but only do not depend. Many people will tell you many things, especially see, Australia is a lot of things about money, 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 so CPD people will tell you often that okay, you do CPD, it's more than enough, but if you have a more than 2 years of gap, it's difficult actually to be considered just, I mean, with CPD and observership. Actually, the best is if you go back to your country and do a 1 month, 2 month, 3 month job. That's best of the best actually. Okay. Great. So there's a two group of people. One, they're living in Australia. They don't live in Australia. So there's like different suggestion for the people. Those are already in the country. Maybe you're preparing for MC1 and you quit your job. Now you can join. Actually, it's fine. There's MC2 exam, which is online available, face-to-face available. You can go for anything. Now that I think that brings us to one of the another confusing thing is to go for MC part 2, MC2 face to face or online. So that's main another topic of discussion. I made a lot of videos in my YouTube channel. You can also check out those things actually. I mean, my point is actually there is nothing like going face to face more pass or online is more pass, but if you're comfortable in online, it's fine. I mean, if you're our student, I think it's fine that because you are comfortable in the online actually. So there's nothing like that. If you go online, you'll fail more. Or if you go face to face, you'll fail more. Nothing like that. Okay, just be confident. And online exam is little lengthy. That's the only thing compared to face, because in online, all station has to finish. Then you go out of the room. That's one of the thing. Someone said, how long it might take to pass. The same thing, like, for MC1, I would say it's roughly 7-8 months actually for MC2. Maximum, it depends on your preparation and how free you are. It might take a 10 month or year in that case actually, but it can be passed in like a 7-8 months actually. And if you're very confident, let's see, different people has different caliber. Some are very good, to be honest actually, so they are well spoken, they have more exposure, they have gone through other exams too. So in that case, it can be like you can take in the exam even in 3-4 months actually. I know a doctor who came from the MRCP background. He was taking that MC2 exam. I said, like, I guess you don't need that much time. So he appeared in 3 months. He passed the exam actually. All right. We tell everyone, try to focus on passing more stations. Okay, it's better if you try target more stations passing. Yeah. So it's like few things about the AMC2. If you go to my YouTube channel, there's already relevant videos. I'll try to post few things just after the class, like regarding the MC2, know about your MC2. Yeah, but few common things: format, preparation. Nowadays it is available face to face, and now this is available online. Very big thing to discuss, like, is it online better or face to face better? In trial classes of MC2, in the first class we discuss about that thing, that MC online is better. So it depends on person to person, fits on you. If you are a bit introvert type of person, maybe online can be more better for you actually. All right, but that's an great experience, guys. Like, try not to miss that experience. Like, you go to a center, give an exam in front of examiner. So that's also a great memory. Like, like online, I don't think so you'll have that kind of memory, but face to face, like for your own satisfaction, glory, like you go to that centers, meet other candidates, though they're in the line. Yeah, so that's a different thing. But if you have that like too much fear and introvert, maybe face to face can be sometimes difficult for you. But anyway, I mean, you just need to overcome the fear. That's the main plan, right? So format of the exam, like 16 station, and 2 of them are pilot station. So you have to pass at least 10 stations actually. That is the thing. Like, I mean, your result is given 14 by 14. It's kind of like that. Recently, many of our doctor passed 13 out of 14, 14 out of 14, 13 out of 14, 12. So we can see good results actually. So we are targeting more like a approach based. See, in MC1, I think I'm the one who did the maximum recalls. In MC2, we also do, but recall is not everything. In MC2, it's all about approach and individual cases, how much you give respect. It is there's very small things in MC2 which you need to be careful. There are like a 200 or 250 cases. You need to be master of those things actually. So you start doing, like, if you want to take the second important thing from me today, other than this job website link, is it should be that you start doing the role play from the very beginning. That's like, so that you appear in exam more early and your maturity comes more early and you succeed. Many of them, they do, I mean, we have courses, Australia has courses, many things. For 3-4 months, people are not doing role play. How sad is that? In our course, from the very beginning, I just put them into the water that, okay, it's okay. So I'm here actually do role play. It doesn't matter actually. So they have to do it actually to attend classes. I don't allow in that way. So I put them into the water from the very beginning actually. So the exposure thing I think is very important, that doing the role play, it's very, very important from the very beginning. Like, it's because it's all about talking in part 2 exam and nice approach and this, that. Some people are shaky, maybe some countries they also don't talk day-to-day English in their life, so they are shaky like in front of others doing a role play, even in the Zoom session. So imagine in front of the examiner how we will do role play, then it will be so intense that time, right? So this is how the overcome the fear and start doing the role play. So as I mentioned, other than the opening the job website, the second thing all you can do today, take from today, is start doing your role play from the very beginning. Another thing, trust me, one thing, what you read in MC handbook for clinical, MC handbook has two parts, one is MC, one is clinical, but what is written in MC handbook, it's very different what you have to approach in part 2 exam. Now this is the thing, if you have ever planned to join our courses, you can take away the recording and later can join live we don't charge extra for that. Okay, so that is another thing. But uh, you usually try use the our note rather than the handbook actually. So that's another wrong approach. I won't say wrong approach, but you don't get actually what is the approach by reading the MC handbook, because it's so big written. That is how we don't do role play actually. That's the thing. So rather, if you have the role play videos and the notes at the same time, you keep doing small. Maybe you will start little later, take out the recording, keep studying slowly, even 2 3 hour later, come to any live classes actually. That's even best actually. All right, so this is another suggestion to you. This is how you stay in the game. Okay, another very important thing, third thing, for God's sake, do not give huge break in your study. It is clearly written in MC2 that your MC1 knowledge will be reflecting in your MC2 exam. So if you give a huge gap, you know start studying, you will forget those MC1 memories already, and then it will not be beneficial. So the ideal is finishing MC1 immediately. If you start the MC2, that's better. Another suggestion here, if you want to do some job related search and this that thing, still you can study every day 2 hours, like whole day you are not going to apply for the job, right? So in that way you can take away any of the recorded course and things, and study like a 2 hour per day and keep applying for the job the remaining time of the day. Okay, in that way you will not lose the focus actually, you will be still in the game. But those are giving a 5 6 months gap. um, if they got the job, that's okay, but most cases you won't with after MC1. So because not everyone has a best CV, sometimes you need also luck actually. All right, so after 5 6 months, now you realize where you stand. Neither you studied after MC1, neither anything happened in your life, and you'll find it yourself in no man's land after maybe 6 months. And time nowadays just goes like that, you'll not realize actually. So just be careful about that one, that be in the game. I'm just telling again and again, be in the game, with me, without me, wherever you go, you start preparing. That's my suggestion actually. All right. MC2 is necessary for ultimately to, yeah, there's some few reasons like, past candidates, that's okay. And yeah, benefit student, I mean, it's okay. I mean, already mentioned. We focus on the notes. Our MC1 has notes. And if you like our MC1 notes, we have unique notes like that for MC2 as well, actually. Okay. It's unique, not matched with anyone, very different, to the point for the exam, actually. That is how it has been designed as well. All right. Next point is coming is PESCI exam. All right. PESCI or WBA. Now I should go for part 2 exam, I should go for WB exam. Guys, MC part 2 related, so many videos you will find in my YouTube, like format, this, that, online or face-to-face. There's a series of videos there for MC2. Please check them actually, or I can share few links after the class. Class monitors can remind me to share those MC part 2 relevant video links, how to start, how many stations, this, that, so separate videos are available. Now, those things are available. So let's focus on few things like, should I go for MC2 or should I go for PESCI exam actually? Now, what is PESCI? This is like a mainly for like if you want to go for the GP, like, pre-employment structure, clinical interview, RSCGP, ARCM, like ACRM, and another one is available nowadays. So it's basically for after finishing MC1, you apply for a job, you get a job. Okay, you need English test for that. You get a job, and then you have to go for a PESCI exam. So three things. All right. So after finishing MC1, you apply for the job. Okay, apply for the job. You need to get the job. Okay, and then you need to clear the PESCI exam. Okay, but it doesn't mean that you are doing the job actually. In order to get into the job, you need a job offer, then clear the PESCI exam actually, and then you go for that. Is it clear to everyone whatever I'm saying actually? So PESCI is if you have more than 5 year or over experience, maybe you can do assessment for the PESCI. Not everyone is eligible for PESCI. If you have like a 2 year, like you are not eligible for PESCI, to be honest, in that way. But if you have more experience, like a 5 year or over, because whatever you would give, they will cut it down. So if you give 5 years, they cut down to 3 years. So minimum you need 3 years. Australian in way, like, they will judge you like, minimal like 3 year, like after cutting down, like they need like the minimal that 3 years actually. Yeah. Now someone asked, Dr. Janitha, how are you, Dr. Janitha? Congratulations. Can you unmute? How are you doing? How are you feeling?
I'm fine, sir. Thank you very much, sir.
Congratulations, big time congratulations.
Thank
And
you.
your question
Thank you very much,
is,
sir.
yeah, yes, and I'm sure you'll get a job. You have experience, I know. So your question was how to get a job offer for the PESCI, right? The same thing.
Yes,
I'll
sir.
give you some hospital links after the session. So just make a good CV and keep applying for different hospitals actually. And PESCI is like, is an exam, and before going to the exam you need job offer. So apply everywhere, even in the remote areas. So remote areas has more
Tomatoes.
job probably for the PESCI actually. Okay, so do not hesitate. Where is your first job doesn't matter, because eventually you can switch actually. After 1 year, 2 year, 3 year, depends on the contract, eventually you can switch and come to the center areas actually. So no matter wherever the first job you get,
Yes.
just go for it actually. Yes, yeah, you might be getting in Western Australia or in Darwin. Yeah, so one of my very favorite student was Dr. Arnab. So he finished MC2, but somehow job was not happening, but again he applied for the PESCI later. So then he got the job actually, but it was in Darwin. So he was telling, should I still wait and apply for more hospitals in Sydney, Melbourne, or Gore? My dear, you got a job, you go there actually. They start earning early. So that's better. And you get into the system more early, it's better. You will know more things about in Australia actually. Okay, Australian system, you have realized from their website or whatever it is the system is bit complicated. You all will be agreed on that one actually. So it's ideal if you get into the system, like other than a lot of things we just keep thinking superficially. Okay, so any job you just get into that, that'll be fine actually. So I'll share some websites so you can apply the job there actually. Okay, Dr. Janita, thank you so much and congratulations
Okay.
again. Yeah.
Thank you, sir. Thank you very
Uh,
much, sir.
yeah. And if any question comes out, do ask me, feel free.
Okay, sir.
All right. Yes. And this is the like the PESCI, this is like the pre-employment. So this is the link for the PESCI, so you can go like PESCI, you can type PESCI RSCGP, and you can also go and you can see this like login and all these particular things like a login. You need to sign up first actually, and make a account, and then all the remaining thing will happen through this actually, this like type of website. Okay, so here's some information you will find regarding the PESCI. All right, maybe I can share this link. Just give me a second, guys. Maybe I can share that link right now. Yeah, I just shared in the Zoom, guys. Please click that one. And yeah, save the link for later. Yeah, I just shared in the Zoom chat option that, link for the PESCI, how to apply for the PESCI exam. Through this one, you can apply for the PESCI exam. Clear? All right. Great. Next is coming is a WBA actually. WBA, workplace-based assessment. Now, quick question. Are you guys, any of you are eligible for WBA? The first criteria, you have to pass the MC1 exam and you need to get a registration and you need limited registration employed as like professional. So you need already limited registration. And so does any of you have limited registration? A quick question. Does any one of you have a limited registration here? The answer would be no, obviously. Okay, so in order to get a limited registration, you need a job offer. So you need a job offer and start doing job first. So this brings us this summary. In order to get WBA program, it's like a MD program in our countries. It's kind of like that. So you will be in the program and it's 1 year, and under 1 year, you'll have multiple exams, and the supervisor exam, lot of thing depends on the supervisor. So they will clear your exam eventually. But in order to do that, you need to already working inside Australia. Okay, and that's what WBA. Only I think 7 hospital has WBA permission actually. Most are in the periphery. One of them is only in the center. Okay, that is the Monash Hospital. So Monash Hospital is eligible for WBA, which is in the Melbourne, and all others are outside as far as I know. Okay, please watch this video by going to our YouTube channel. If anyone, if it is possible among the class monitors, find this video and share this link in our Zoom chat option actually. So workplace-based assessment, you can have a look actually, so the main thing, you need to start working in Australia and you need to have limited registration. After MC1, the process of working in Australia after MC1 is getting a job offer and then getting limited registration actually. So you need to have limited registration to work as workplace-based assessment. That means if you're just staying in home country, you can't apply for the workplace. Okay, great. All right. CV tips. Now, CV tips mostly we give, it's a big thing to tell. So when you come to our MC2, hopefully someday, so there is like CV related separate session. We usually invite a CV expert to give that one, but clean, precise CV, not too long actually, so that type of CV is more recommended. Like some particular format, but as I mentioned, different hospital you may need different types of CV actually. That's the thing. Okay, so I'll try to post a CV related a template little bit, like how the basic format should be, like AFRA CV format. I will try to share that one. Classmates can remind me. I will try share. Let me just give me a second. Let me try to see if I have that one with me now. Just taking a minute, guys. I think I got it. All right, so this is a format for AFRA CV, guys. This is the format for AFRA CV. Actually, these particular things you must need to add, or you can just type in Google like any good CV, good format. They will show you the color gradings actually, that you can, anyone who is good with the computer can do it for you. But these particular things, make sure you include in the basic CV actually. Okay, there's a lot of CV providers out there as well. You can, if you want, you can take help from them. There's no harm in like taking, because there's a word, every CV is just checked for 40 seconds. So your whole life, it's depending on it just for a 40-second, like some people just see, okay, CV photo, like this, that, so it's common actually. Yeah, so I'm just sharing that one in our Zoom chat. Please, go and download that one. Yeah, so it's been shared actually, guys. Yeah. So I hope you like that one. This is the AFRA CV format. And let me try share that hospital links now. I'm just taking a second, guys. Okay, guys, try. I'll be waiting here, so don't worry. So I'm just sharing few things in the link of the hospitals. Just try to copy them. Yeah. Oh, let me share the screen. So these are some of the the website thing I just shared. Shared some of them already. Let's check our Zoom chat. Okay, so these are the hospital, yeah, like. All right, and CV related few things like, as I mentioned, and I show you a format and all this thing. Yeah, so CV related more other things, we definitely have detailed thing on that AMC our part 2, like, the course we run, like, we talk more about the it come as a compile class, CV, cover letter, and selection criteria. So there's more expert. Sometime I took it, sometime Dr. Qureshi took it. Limon will take this time actually sharing his experience about the CV, but I shared the format already. I think that'll be fine actually. All right, so please copy it from the Zoom, and I wish you all the best. And please take care. Do you have any other questions, guys? Please let me know. All right, any other last questions? Please let me know. Someone asked, what time do AMC to release exam date? I mean, it depends, like, previously it was 15 days in our time, then it was extended bit. It depends actually, yeah. Yeah, you can unmute and ask. Yeah, it's open mic. That's why we are here for
Good
today.
afternoon, Doctor.
Hello,
And
doctor. Congratulations. Yes,
thank you
congratulations.
very
In
much.
short time, you finished it. Congratulations. Very recommendable.
Thank you very much. So my question is for the APRA, when we are ready to do our license after securing a job, do we have to provide our pay slip for our past experience, or will our account statement be enough?
Yeah. Your past experience and everything, it has to be, added in the CV actually, and also keep those as a document. They might ask you those things later, but you need to, like example, say any CV. You need to mention that one, that from this time to this time you are working, and if possible in one side, you try to put the while you're working, if there's any relevant website of that particular job company actually, so you know what I mean actually. So this time to this time you're working, and any website if it is available of that particular hospital. Yeah, so that makes that thing more relatable. And is that the question you asked, doctor? Is that the question you asked?
No, I mean, when we are ready to do our license, will APRA ask us to provide bank statements to show that we got salary in that job? Or do we need to provide our pay slip for that job, for the previous jobs that we have done?
Most cases they don't. Most cases they don't, but if they suspect, they will. Yeah, it depends, because sometimes some hospital, they see the website, they understand it immediately by seeing the paper. But some cases, see, it's more like a immigration department. Like, there will be a portal. So if they need something extra, they will ask you through the portal that, you are requested to add this police verification certificate. So sometimes most of the job, they need police verification certificate. So they might add you that one, that you need to include your police verification certificate, or the what else they wanted to see, they will add that one in that case actually. Yeah, so no worries on that one. You will get through this actually. Like, just make a proper CV, keep applying. And in terms of AFRA registration is a whole different process actually, so that's actually, you go to the AFRA website and go through that, registration process. They will ask you a lot of things, this, that. But in order to get AFRA registration, the first thing comes out is, because you can't do AFRA registration now, even actually, you need a like job offer to do AFRA registration actually, right? So, I mean, first thing is going for the job application, job offer, and then the AFRA registration thing will come. So there are a lot of type of registration, like limited registration, professional registration, yeah, and GC, the general registration. General registration only possible when you finish the AMC Part 2 exam, and then you can apply for the citizenship actually. So that's a whole, quite a big process in it. They might ask you a lot of things actually, for the AFRA registration process actually, yeah, no worries. It's a long process, let's not get there. It's a long list of process. They'll ask you a lot of things actually in the AFRA registration actually. Yeah, it includes your certificate, experience, blah blah, this, that thing. I think you guys have a look, one album, we have that one in our video channel. Like, if you just take, mind me, take the screen off for a second, just to think. Yeah, let me just take you guys to our video channel library for a second. Okay. Example, if you see, if you can apply for MC1, if you're to the extension like called remitted registration. So, example, I can add you here, Dr. Yeah. So you can see that one, like, medical board and limited registration. And if you click that one, it will take you to, yeah, to the other relevant. Yeah. So this is the thing, AFRA registration, and you can find, whatever that will be required. Just follow the instruction actually. Okay, it keep changes, so you need to first sign up again, and you need to go accordingly. Yeah, you need to go accordingly on that one. Application, so application form letter is available on the form page. So you need to fill up first, starting with this, applications already registered or provisional or not. So you just need to follow all these instructions. Yeah. Is it a renewal or is it a like details? Yeah, so you'll find the application process. Yeah. So you need to find out which category you belong to, and then just keep, checking in that way. Yeah. So a lot of things out there. You need to go and fill up. Yeah, that things. You can see that, right? A little complex. That's why, I don't go there usually in the seminars actually. Yeah. So you see, like, these are like the questions actually, international medical graduate. So they'll ask you a lot of things and you need to fill up these things correctly. Clear, doctor? Okay. All right. Yeah. Yeah. So same app will be available for application for general registration, applicable for professional registration, applicable for limited registration. Okay. So we just need to, yeah. All right. Any questions more, guys? Any more questions? Let me check.
Hello, sir. Yeah,
Yes, doctor, please.
I wanted to ask, is there an average time duration for the limited registration? As in, when you apply for the limited registration, how long does it take for them to approve it?
That's difficult to tell actually, but usually, like a month, I guess, like a month. In a month it would be fine, I think. Yeah, it varies actually. If your all papers are fine, I think in a month, and even more early, it can be done. Sometimes it depends. Like some cases they have fast track services, some cases not actually. So it depends actually, But it usually it takes a month, some cases even more actually. Yeah. If you go to the limited registration website, the recent all the information they will provide you actually. How much takes this that. They have also their email, and so they can also email then how much time it takes, and they'll tell the same actually. So the standard time they give, like this week, like as like the same visa process, like 4 week to 8 weeks. So they'll give you a timeline actually, like that exact one. I don't remember, currently. You need to check it in the website actually. All right. So guys, I mean, registration process I'm not getting into. It's not like much my expertise actually, the registration process. So registration process, please do check it by yourself, because it's a long list of thinking. When you solve one time, later you forget. You don't really want to remember those actually. So many things comes one after another. Yeah, so just go and check that one. Lastly, let's finish with that one, observership. You can try observership if you're inside Australia. Many hospital like Blacktown Hospital, Liverpool Hospital, in Austin Health in Melbourne, then I think Monash. So many hospitals, they offer the observership. You can also go and apply for that one actually. Some cases free, some cases you might need to pay $500 or $800 for that 1 month of observership actually. But that will give you exposure, and that will also give you a path to know how to approach, how to enter into the system. All right. Any other questions? Did I miss any questions from the doctors? All right. See, I mean, someone asked about services. Services is totally up to you. Personally, I don't like directly recommend in that way actually anyone's name, because we are very big names. So telling one's name and directly become some other's enemy. So I don't do that. But most of the services are good actually. Whatever someone wrote there actually, about the services. Many of the services are good actually. I would say actually, you have to it's about reliability. I mean, see, all things are reliable, but depends on whether they are uh, satisfied your need, whatever you are looking for. That is not sure. Even if I recommend someone, they might not fulfill what you are looking for actually. In that case, it creates a bad impression actually. So I don't want to take blame from some other's name, or so they often offer me as well to get tagged with them actually, that in terms of the um, because we do have the highest number of AMC students definitely in the world. So they always wanted to tag with us actually, but I denied those offers actually. So let's not go there actually, and because responsibility is a different thing actually. Okay, someone asked a question like, can anyone find observership outside of now, outside Australia? You can do anytime in your country. I'm talking about Australian observership. Australian observership means you apply inside Australia. Now maybe your question is, can you ask that question, doctor? I mean, I just need to be sure. I mean, for example, I know you're from India, so you want to do the observership outside India. Is it something like that? Yeah, you can unmute and ask Dr. Vijeta, I think it is.
Hello, sir.
Hello, doctor. Yeah, I
Yes,
remember
actually, on
your medical is not in your home country, right?
yeah,
That's
sir.
the point
Yes.
actually. So your question was basically your own medical is outside it was in Russia, I mean, was it?
No, sir, it was in Kyrgyzstan.
Okay, Kyrgyzstan. Okay. So it's
Yeah.
outside India, so you had to come across. But have you gone through that MCI exam or FMG exam that is called in India? Have you gone through that one?
No, sir, not right now.
Oh, okay. All right. No problem
But,
on that
sir, we
one.
have got the internship certificate from our university.
okay, that will be fine to apply for the exam registration process. And so the question is coming. See, the standard is Australia. So most cases, the other observership, they won't value much. That is one of the thing.
No, so
Australia
actually I wanted
usually
to ask that can we find like in home country from here only we can find the observership in Australia, or we need to be available in their country?
no, you have to be available. You have to go to the hospital, right? I mean, say example, it is an Australian observership.
Yeah.
Someone will be your supervisor, and under him, you have to go to hospital and um, keep working there. Actually, I mean, you don't really give treatment to the patient, but you'll be helping, assisting, and check out the procedures and whatever they're doing ethical. So that's example, like say Liverpool Hospital in Australia, in Sydney, or Blacktown Hospital. They do have the observership. So you apply from India, and if it got accepted, you go there and do the observership. Actually, after MC1, you can do that even in Australia.
Okay,
Actually,
sir.
yeah.
Thank you, sir.
Your question is about in your home country, applying that one. As far as I know, to work as Australia and India, you need their own registration exam clearance to work there. Actually, though now it's a critical thing, whether they, accept it or not, because you are not qualified to work in your own country because you didn't go through the license exam of India. So whether they would allow it or not, that remains a question. So I'm not so sure about that actually. That without clearing the FMG, that is called, right, FMG exam, will they allow first of all working in Australia? And even if they allow, will that be a legal or illegal? So that matter, I think you need to be clarified from the General Board of Council actually of India. Actually, that is one of the thing actually. But in terms of applying in Australia, you are always more than welcome to apply in Australia, UK, or any of those countries. Like observership in a lot of countries, but make sure it reaches the same standard actually. For example, Australia, definitely they count UK, Ireland, USA, this similar level of country, New Zealand as well, English speaking country mainly, with good medical history actually. So those countries, any experience, they count a lot actually. All right, so this is the thing. Example, let me tell you by finishing this thing. Most cases, our Asian doctors, their specialist pathway papers are not accepted. I saw very few, and one of the characteristic thing I see the specialist pathway in them, that they have the working experience in like a country like Singapore, UK, and this kind of experiences they had actually. So they, as a direct consultant, managed to get into Australia and start working there kind of directly as a consultant. But most cases from the Asian countries, it is kind of difficult actually, like talking about as a consultant. But as a doctor, they are always ready to take RMO, SHO, this, that. Yeah. So for you, suggestion would be at certain point, you keep applying for the observership. And in India, like you can try doing some short courses. Like example, Apollo Hospital has short course. Rather, you can try the hands-on diploma courses and that particular things. Okay, those are also counted actually as like enriching the CV, and things will be counted. But directly getting into a training program and working as a doctor, as far as I know, from legal point of view, you need the license exam. But if you want to do a degrees example in Apollo Hospital, that might not required some cases that thing. So
Yes,
with
sir.
money you can just do it actually and enrich your CP actually. And later you can do an observership. See, I mean, those have observership in Australia thinks that maybe they have a better understanding about the system. So in that case, they give a little bit more priority to those doctors, those have observership actually. But that's not the main thing. They first look forward to things like experience. So like the fourth thing today, if you want to take from today's seminar, three things earlier I told. If you joined later, I mean, if you haven't seen later, you can see it. The fourth important thing is actually, if you don't have recency, my dear, please make sure you enrich your recency by working in your home country. That is highly recommendable. If working in your home country, if it is not applicable. For example, so you said you studied from Kyrgyzstan, so you have the license in Kyrgyzstan probably. So maybe you can work there. By going there, you work there for 3 months or 6 months. That's how it is. It can be done. All right.
Okay, sir.
Okay.
Yes, sir.
So recency is important. Like you are touching patient, you are working with patient. That is very important. Very, very important thing. And in terms of CPD, see, CPD means any activities which enriches your medical practice in Australia. Example, you are doing a course that's also under CPD. Like, we example, when you really apply for job, you can also reach to us, like, if you're academic student, because we have long courses, 5 months, so you can get a lot of CPD out of it actually. Okay, so CPD also works, but the main thing is recency, I'm telling you. So recency is the number one king here. Then comes the observership, then comes the CPD. So CPD is the lowest. Clear, everyone? This is the thing, small breakdown I wanted to just clarify actually. So clinical experience as a doctor, that's the number one actually. That then observership, it's like a cherry on the top, or a crown on the in the main crown actually, like like a stone on the main crown. That's the observership actually. And CPT is like a very small things actually. And keep working with the networking. Many times I've seen also, see, it's a long journey. Like since 2016 I'm teaching. It's like we reached 1,000. It's like recommendable number actually. Like from this is like August we are recording this thing live session, and 1,000 doctor passed. Would you imagine? Like it's a very big number for any academy, to be honest. Yeah. So that's the thing. I think good luck to all of you. We keep tracing our doctors, like we know, and more than 450 is working now in Australia. Many are in the process of MC2 and this that. So it's always doable, and keep going. Don't lose hope. And sometimes people might say Australia does not have job. What a joke, So I like to finish with that one, So there's like, how come a big country don't have job? Actually, this is like a bullshit thing, So it's just like, you just need to be in the right time, in the right place, and apply maximum hospital. All right. Thank you so much, guys. I think we can end that one. I hope so the session is helpful. Some links has been shared. I hope so you can copy them. And good wishes and best wishes for the exam. Anyone interested to join our MC2? Coming up some of the courses, I think September, and then there'll be a December, there will be courses we are planning. So if anyone wants to join, then feel free, and think good luck to you, all of you. Thank you. Bye.